I am Kayla Haslog. It is October 18th, 2019. I am a first semester nursing student. I will be performing a wet to dry dressing change, and 30 minutes prior, I have already assessed the patient's pain and have pre-medicated. Hi, Mr. Jones. I'm Kayla. I'll be your nursing student. I'm going to go ahead and do a wet to dry dressing change on you, okay? I'm going to pull the curtain for some privacy. Can you tell me your name and date of birth? All right. I'm going to slide on some gloves. I'm going to go ahead and remove this ABD pad, tucking the tape so it doesn't adhere to the patient's skin again. Flipping it over, I will assess each gauze pad that I pull out for any drainage, the color, and the odor. Alright, everything looks good in there. I'm going to just throw this away in my glove in the trash can since there wasn't too much drainage. So now I will perform hand hygiene again and start my sterile technique. I will open my dressing change. Go ahead and open my sterile gloves. I am right hand dominant, so I will go ahead and put my right glove on first. Grabbing the cuff. Sliding my fingers under the cuff. All right, I will begin to take everything out that I'm going to be using and placing it on my sterile field, making sure I do not drop my hands below my waist. I won't be using this. Won't be using this. All right, I will begin by measuring my wound, making sure I don't touch the patient's skin with my gloves. So it is 7 centimeters by 10 centimeters. I'm done with this, so I'll be throwing it in the trash. All right, I am going to go ahead and wet my gauze pads. I'm going to check for any tunneling that the wound might have with a cotton tip applicator. I have tunneling at 11, 12, and 1, and I have excessive tunneling at 7 o'clock. So I'll be throwing that away. I will clean the wound using each applicator on one side. All right, I will begin by pulling one of these out at a time, making sure I have complete control over it so it does not touch the skin. And I will be applying it with a cotton tip applicator. I'll be making sure to focus on putting it in the tunneling, placing the gauze pads in the tunneling. All right, and one more. Okay, I'll be throwing that cotton tip applicator away. And I will remove the excess gauze that I did not use. Grab my ABD pad out, putting the blue to the sky. And at this point, I can take off my sterile gloves. And I am going to tape it down. Making sure after I get it completely taped to put my initials, the date and the time that I did the dressing change. Initial, cover Mr. Jones back up, making sure his bed is down, his call light is next to him, and I will walk out of the room and document anything else.